official of the World Health Organization, is here in the Situation Room. Our correspondents across the nation and overseas, they are all standing by as well. Joining us now, a top official of the World Health Organization, Dr. Jon Andrus, is Deputy Director of the Pan American Health Organization's Regional Office for the Americas. Dr. Andrus, thanks very much for joining us. You have a sense of potentially what went wrong here? Because she was wearing protective gear.
Well, I think it indicates what Tom Friedman has been saying for a long time now, and it's meticulous detail to infection control. In a former life, I worked in a district hospital in Machinji, and I was trained never to tie or stick a needle in blood that you cannot see the needle point, but you do it. And I can say that I've stuck myself a number of times. So it's the element of human error that we have to overcome with infection control, because it's one mistake that will transmit the disease.
Because there could have been, in the last few hours of his life, Mr. Duncan, the Liberian man who died of Ebola, they were doing kidney dialysis, they were doing all sorts of treatment on his lungs, and potentially could have been coughing. Could that have been enough, even if she was wearing all that protective gear?
It's unlikely with cough. This is really direct contact with blood or other body fluids such as vomitus or fecal material. These are liquids that nurses have to care for when taking care of a patient. So it's more likely that she breached the infection control and exposed herself. We commonly see people rubbing their eye or scratching themselves after as they are taking their equipment off.
So it can be very dangerous, just the whole process of removing all that protective outfit, if you will.
Yes, and again, it's one mistake, and that's what Dr. Friedman is saying all along, is meticulous attention to the guidelines.
So, which raises the question, are our healthcare professionals in these emergency rooms at these hospitals, and this Dallas hospital is obviously an outstanding hospital, are they prepared, though, for Ebola?
Well, they are and they aren't. I think that the point I'm trying to make is that even when you have the best training, humans being humans will make errors. I think this has been well documented. So if you take that model and then look at the African situation where there is no system, there's there are poor conditions where transmission will happen regardless of how trained you are. In both situations, there are different challenges. Bottom line, meticulous attention to the guidelines and using procedures we know work.
Should she be there at this Dallas hospital, this Nina Pham, or should she be moved to Nebraska where there's some other Ebola expertise, or the Emory University Hospital in Atlanta? In other words, do they know what they're doing over there as far as the specific treatment she's going to need?
That's a question I can't answer. That's a question that should go to the local authorities. But you know, in this case, if they feel they have adequate infection control, if they feel they have the mechanism to supervise and monitor, I think that's key in any public health intervention. That human element of supervision, monitoring, following up is absolutely fundamental. We know in the response in Africa it's going to require human resources, more doctors and nurses to get ahead of the curve, because this epidemic is doubling every 3 weeks. So what we calculate now is the number of nurses and doctors in 3 weeks' time may be double that. David Navarro the other day said that we need to ramp up 20 times what we're doing now. So what's happened in Dallas is one element, but the big picture, where we're stopping the outbreak at its point, at the source, is absolutely critical. Because as Dr. Chan said today in his speech, that when this a virus that is so severe enters such a vulnerable population, it puts the whole world at risk.
Yep.
And we don't have the capacity or the ability to face it right now.
We know that 8,000 people have already been contracted with Ebola, 4,000 or so are dead, and those numbers may be low given the records that are being kept in West Africa right now. Dr. Andrus, thanks very much for joining us.
Thank you.